I'm all for people wanting to get boosters, and that's great if they want to. But would you really queue up 5 hours for one?
I know. I find this really, interesting that we've actually reached a point where people are so scared by the story that they're being told that they will queue for 5 and 7 hours. But what worries me more, Mike, is that we've still got 25% of our care home residents not having had a booster. And if we're going to give boosters, surely our priority should be to give it to the people who are most likely to die. And that isn't healthy under 30-year-olds. And yet I am seeing under 30 healthy people who have not only had COVID, but they've had 3 boosters. And yet the rest of the world, the developing world, places like South Africa and the rest of Africa, don't have vaccines. We're constantly accused of being selfish for not wearing masks and not doing this and not doing that. Are we not being selfish as a nation by not looking around the world and having a more global view on this?
Yeah, no, I think you're absolutely right. Because unfortunately, we keep hearing from the government that, well, the thing is, we haven't really got the data yet to be able to judge whether this is dangerous. It might be much more dangerous than we know. But they have got some data. They just keep ignoring it, don't they?
Well, I think they have got some data, and there's lots of good data coming out of South Africa. And let us not forget that while South Africa does have a much, much younger cohort of people than we do, all of Africa does, the average age in Africa, I think, is about 20. So, yes, of course, they have an advantage there. They also don't have vaccines like we do. We're on to our 4th vaccine. So we are in a far, far better place than any of those countries. And yet, when we listen to those countries and the chief medical officer there, they are looking at us like we're bonkers and saying, what are you doing? This is a mild disease. And I think it's time for us to step back and say, look, we've done everything we can. We need to live with this virus, like Chris Whitty says. We've all had, most of us have had 2 vaccines. And actually, there is data coming out of South Africa today that says the Pfizer vaccine is still 70% effective against hospitalisation and serious disease and 30% against infection. So why are we concerned about being infected if it isn't going to harm us?
Well, that's what I wonder about as well, because you're a doctor, you'll see patients on a regular basis. I mean, is there a sense that this particular variant is now getting to more people so that more people are possibly becoming infected with this version of COVID, but actually they're not feeling very good, they're not feeling very nice, they're not feeling very well, but they're not in any great danger?
Well, we're certainly seeing in London COVID is rife, and we are seeing lots and lots of cases. I haven't seen anyone from my practice hospitalised in the last few weeks. In fact, across the pandemic, I haven't seen that many people hospitalised, because when you look at the data, being hospitalised is actually really, really slim as a chance. What I have seen though, Mike, and this is what upsets me, is every single person I see, be they 18 or 80, feels that if they get COVID, they will die. And actually, that's the complete opposite of what's likely to happen if they get COVID.
Right, because hardly anybody dies. I mean, that's the one point I've been trying to make all the way through this for 2 years practically, that, 99.9% of people who get COVID survive it, don't they?
Well, they do, but that stat is actually, that's not the right way to look at it, because actually, if you break it down across the ages, if you're 30, you've got a 99.9% chance of surviving COVID. But if you're 75, 80, 90, or you have some serious comorbidities, then your chances of dying of COVID probably go up to about 10%. So it's very different depending on your age, which is why I've always supported that what we should have done from the start is identify those people who are most likely to die, because let's face it, as a doctor, what we want is to stop people dying, and then we should have focused our efforts on them, put all of our money and everything into protecting those people and allowing the healthy young people, very unlikely to die, in fact as likely to die as flu if you're 30 and healthy as you are of COVID, then, let them get on with their lives and stopping all this restriction, which has done so much harm in terms of other diseases being ignored, treatments not being able to be accessed, mental health going through the floor, children losing education. The list is endless.
Yes, and I know that you've been in touch with people who have been telling you what they've received from their GPs, including messages like this. Practices have been asked to stand down all non-urgent work. Please do not phone the surgery unless you have an urgent need. We will need to cancel some booked appointments to enable us to focus on the government's COVID booster vaccination target. I mean, it seems like a sort of obsessive, boyfriend or girlfriend that you've got. They can only do one thing at a time. It's like they can't do anything else. Why do they have to put GP surgeries on hold effectively for everybody else and anything else that needs to be done?
I don't know, Mike, and this really worries me because I really do think we are almost back to the beginning. It's like Groundhog Day.
Mm.
And my concern at the beginning was always going to be those people who couldn't access healthcare, who are going to get sicker. And certainly my friends working at the front line now are seeing people presenting in A&E with much, much more advanced disease than they would have had if they had been brave enough to come forward at the beginning of this when they first got their symptoms. And that's absolutely tragic. I think the long-term harm from making people scared of the NHS or making people believe that they were doing the right thing to protect the NHS, which is not their job, by the way, it's going to live with us for decades.
Yes, exactly right. And as far as the problems in the NHS in general are concerned, they will continue to mount up, won't they? Because now we've gone back to the kind of COVID health service. We're now going to have more people not screened for cancer. We're going to have more cancer situations ignored and not dealt with quickly enough. We're going to have even more waiting times increased for people, and there are already millions and millions of people waiting for stuff. You know, when is the Department of Health going to work out that this is not the way forward?
I don't know, Mike, but if you look at everything that's going on, none of this seems to be based in science. I mean, we've got them being absolutely terrified by SAGE again and their predictions, none of which have ever come true. You know, to be told that 75,000 people will die from this variant, which is all based on Delta. If you actually look at the small print in what SAGE have said, they're basing this on the lethality ratio of Delta, for which we have no evidence. In fact, we have evidence to the contrary, that it isn't that. We also have many more vaccines, many more boosters. So they're going with these fear tactics. They're going with vaccine passports because it will pass today, obviously, because Labour have decided they're part of the government. And, you know, there's no evidence for vaccine passports. In fact, if you look at what the CDC said yesterday, they looked at 42 people with Omicron and they were all fully vaccinated and a third of them had actually had boosters. So what does a vaccine passport tell us? It tells us somebody's had a needle in their arm. It doesn't tell us they're safe. It doesn't tell us they haven't got COVID, and it doesn't tell us they're not going to spread it.
And it says now that I hear more and more from government ministers, they're calling it a COVID pass rather than a COVID passport. I'm not quite sure what the difference is. Do you?
I'm not sure, and I did notice that language change this morning when I was silly enough to listen to Radio 4, actually, Mike. I'm
Steady.
sorry.
I know. Listen, I'll forgive you just this once. Don't do it again.
It depressed me quite a lot listening to Radio 4 this morning because they also pushed Ed Davey really hard on these vaccine passports. But what they kept saying was, but surely, Ed, we've seen a study from Oxford today that says that if you put vaccine passports in, it convinces young people to have a vaccine. This is the complete anathema to proper consent for vaccines that's in the government guidance. It says that people must not be coerced. If they are, the consent is not valid. So what are we doing?
It really is bizarre, isn't it? And Jamie Jenkins, I think you retweeted this today. COVID cases up 41% week on week in Scotland, up 9% in England. And Scotland has a plan B that MPs in England are voting on to control COVID. So we're following what they did in Scotland, where currently they're probably looking at maybe 5 times the number of cases that we've got.
It's just bizarre, isn't it? I mean, if you actually have a thinking mind, surely you sit back and think, hang on, none of this makes any sense. You know, a 12-year-old could put a line through this and say, no, that's not logical, that's not logical. None of it makes sense. So you then are left thinking, well, why are they doing this?
Yeah. I mean, I don't think there's anything particularly, sinister about it. I just think that they can't let it go. I think they've got themselves into this kind of cul-de-sac and they don't really know how to get out. And the only way that they can stay where they are and tread water, if you like, is to continue on with this mad idea that everybody has to get vaccinated. It's already Sajid Javid is making noises to say that, you know, next year fully vaccinated will not be 2, it will be 3 or possibly 4. You know, and they keep moving and shifting everything, don't they?
They do, and you look at Israel, who are now on to number 4, and people who have 3 vaccines are no longer considered fully vaccinated. And I find it really, really sad. Not because I'm saying to people don't get vaccinated, because I've always said if you're vulnerable, you're at risk, or you want to have a vaccine, then absolutely you should. But you should do it because that's what you want to do, not because you're being bullied and coerced or life is being taken away from you as sort of the carrot being dangled out in front to make you have it. This is not medicine. It really isn't. It's not the way that we give medicines to anyone, and it shouldn't be the way we give medicines to anyone. And we shouldn't be dividing society by what medication you decide to take.
And from the point of view of herd immunity that we sort of hear about from time to time, but then it gets forgotten, and for what we know of antibody testing, and for what we know of how many people in this country have got or have had COVID and or have had a jab, at some point surely we have to say, well, that we've now reached sort of peak saturation now, haven't we?
Yes, and I mean, I think actually, as I've said right at the beginning of this, if Omicron is as mild as the South Africans are telling us it is, it could be the Christmas gift that we've all been waiting for. It could be the variant that comes along, goes through everybody who hasn't had COVID, gives us immunity, because we know that infection actually gives you the best immunity that there is, and we reach herd immunity really quickly because it does appear to be very transmissible. And then the pandemic is over. We have an endemic coronavirus, which is like a cold, and that's the best position we could be in. The question then becomes, well, do we then dismantle everything, stop all of these boosters? Because why do we need to be boosted against a cold?
Yeah, well, that's a very good point. And of course, the collateral damage in our schools will continue to be felt. I've got a text here from Jeremy who says, good morning. He said, I received an email from school yesterday advising that pupils have the correct internet medium to undertake undertake online learning in the new year in the event of further restrictions. Terrifying.
I don't want to depress you, but my daughter was actually given her slip with her sign on to Zoom 2 weeks ago. And I was told very carefully to, not discard it and to keep it. I don't even know where it is. I threw it away because You know what, Mike? My daughter is 3 years old. She goes to nursery to play with toys, and that's what she's going to do. She's not going to be on Zoom. But more worrying is the older children who go to school to be educated. And we know already that we have damaged the educational chances of these children beyond repair, that it will affect their life chances so much that it will breed more ill health, because poverty from not having good life chances breeds ill health. So we are damaging our health for this particular infection forever.